Hi, I'm Dr. NGYN and I have a clinic in Portland, Oregon. I'm going to talk about vaginal tightening. I get frequent questions about women after childbirth saying things just don't feel the same. The vaginal tissue is designed to allow the passage of a child through the birth canal. The vaginal tissue is very much like an accordion that stretches and then goes back with some recoil because of the collagen in the tissue. Depending on women's tissue type, some women have a problem with the vaginal tissue just not coming back to its original state, and women describe a loose feeling during intercourse. The looseness in particular has to do with what I call the walls of the vagina, the hallway. The doorway can have a sensation of looseness, but the actual vaginal tightening is carried out by tightening the wall under the bladder and the wall over the rectum to actually create more friction by narrowing the caliber of the vagina. This surgical procedure is done very carefully and should be done in the hands of a trained surgeon. The laser is used to open the vaginal mucosa or the skin, and the tightening is actually carried out by bringing together muscles under the vaginal wall and bringing them together to create strength, so that it's not just tightening the skin, it's actually bringing together fascial tissue and muscles to create support that will last a long time. Women can either have loosening of the wall one side under the bladder and have an anterior tightening. They can have loosening of the posterior wall over the rectum, so just have a posterior wall tightening, or a combined procedure, which is an anterior-posterior repair, which actually tightens both walls of the vagina. It's important that we don't change the length of the vagina, and actually that the diameter is appropriate and not too small that would result in pain. All of these assessments are made at the consultation, and a decision is made as to what the appropriate procedure is for the patient once a physical exam has been carried out. We actually can't measure that vaginal tightening yet, but we're working on designing an instrument to allow checking the pressure before and after the procedures. But on tactile and physical exam, there's a profound difference after the procedure has been done. And on sexual satisfaction, there's a profound improved satisfaction with sexuality.